Hi, I am Tan Ken Jin. I'm an orthopedic surgeon and I specialize in foot and ankle disorders and surgery. I practice at Mount Elizabeth Novena Hospital. In this video, I'll be telling you all about caring for your bunions and treatment options for your bunions. So bunions form, like we mentioned earlier, when the big toe bends towards the second toe. This leads to a deformity at the big toe joint. It's almost like the toe is falling off its metatarsal bone, which is this bone. And so what happens is that a ligament imbalance happens and a force then continues to keep on pushing the big toe towards the second toe as we walk. Once this happens, then the bunion tends to slowly get worse and cannot come back to a straight position. So how do you know you have bunions? Basically, a bunion is prominence on the inner side of your foot, and most people will see like a bony, a hard prominence on the inner side of the foot. You may feel like your foot is broadening because of this prominence, and the prominence may be a bit red and painful, particularly after you've exercised or worn shoes. So the easiest way to alleviate your bunion symptoms would be to look at your footwear. Wearing shoes with a wide toe box or open slippers or sandals will prevent friction and rubbing on your bunion, and so will prevent you from getting too bad symptoms. Other people may rest and ice their foot in the evening when the bunion is painful, or take some simple painkillers or anti-inflammatories. Yet others may buy some splints to wear for their bunions. These may help alleviate your symptoms, for example, if you wear them at night. But over time, they are not able to actually correct your bunion. Well, the most common issue if bunions are left untreated is that they will progress. Means the bunion will get bigger slowly over time. At some point, most people will start developing symptoms from their bunion. So other than the fact that you can see the bunion, they will start getting painful and red, and they will start restricting your choice of footwear. In other patients, it may affect their exercise choices. For example, after walking for some prolonged period, the bunion may hurt more. As the bunion continues to progress, then other issues that can arise include very thickened skin and callosities underneath your big toe and your second toe. And over time, you may find that the big toe crosses over and forces the second and third toes to start forming hammer toe deformities, which can be painful in their own right. For worse bunions or painful bunions of moderate to severe severity, you can certainly consider surgery for your bunions. There's many different types of bunion surgeries that are available and have been described. These include things like a bumpectomy surgery, where part of the bone is shaved only, to things like fusion surgery or open surgery to correct your bunions, and finally, minimally invasive bunion surgery. Generally, if your bunion is interfering with your lifestyle, is painful, that is a good time to consider seeking treatment for your bunions. It is good to seek treatment early for your bunions, and we encourage that because a bunion is a deformity, and so any deformity, if it's treated early, it's always easier to treat it than if we are treating it late. If you, your friends or family have painful bunions, remember that they are a very treatable condition, and I would recommend that you can consult your doctor to understand more about your treatment options. Please watch the previous video to refresh your memory about an introduction to what bunions are, and do watch the next video if you wish to learn about getting surgery for your bunions and what the recovery is like. Like, comment, share and subscribe to Medical Channel Asia for more information.